This is the next part from the video topic on the local anesthesia. Here I will be explain the classification and some of the mechanism of some of the drugs of this local anesthesia. Local anesthesia has been classified into two groups, that is your injectable local anesthesia and surface local anesthesia, and each group has been again subdivided. We will be seeing each in details. Injectable local anesthesia, it has been subdivided into three divisions, that is your number first, low potential and duration, example your procaine, and then your second one is your intermediate potency and duration, your example is lidocaine. The third one is your high potency and durations, that is the example of this drugs is tetracaine. This is the example and the group of the first group, injectable local anesthesia. Let's see on the second group, that is your surface local anesthesia. It is subdivided into two parts, that is soluble and insoluble. In the soluble you will find the example is your cocaine, and then insoluble you will find the example is your benzocaine. This is the classifications of local anesthesia, and let's see the mechanism of action of this drug. Mechanism of actions of local anesthesia, and here you can see that the local anesthetic, it acts by decreasing the excitability of the nerve cell without affecting the resting potential, because the action potential or the ability of the nerve cells to be excited is associated with the movement of sodium ion across the nerve membrane. Anything that interfere with the movement of this ion will interfere with the self excitability. So for this reason, many hypotheses has been suggested to explain how the local anesthetic regulate the changes in the sodium ion permeability that underlie the nerve impulse. These hypotheses include the direct action on the ionic channel that interfere with the ionic flusses, and interaction with the phospholipid and calcium that reduce the membrane flexibility and responsiveness to change in electrical field. The non-specific membrane action of local anesthesia can be easily ruled out because most clinically useful agent, in contrast to the general anesthetic, it possesses a defined set of structure activity relationship. At much of the higher drug concentration, local anesthesia also bind and block the potassium ion channel. Here we can see a little bit on the interaction with the phospholipid and the calcium. Calcium exits in the membrane in a bond state. Many investigators believe that the release of the bond calcium is the first step in the membrane depolarization, and that this release will lead to the changes in the ionic permeability described previously. So here you can see that the evidence has been offered that in support of the theory, both calcium and local anesthesia, they will bind to the phospholipid in vitro, reducing their flexibility and responsiveness to changes in the electrical field. Also, the membrane excitability and instability increase in the calcium deficiency solution. Here, the local anesthesia counteract this abnormal increase in the excitability, and more local anesthesia is necessary to block the excitations in the calcium pore solution. Direct proof of this hypothesis, however, is lacking because of the difficulty in measuring the temporal calcium ion movement in vitro. It is also possible that the aforementioned cause and effect relationship between the intracellular free calcium and the membrane excitability, it is the result of the sodium calcium exchange reaction. That is, the influx of the sodium displaces the membrane's bound calcium, which lead to an increase of the intracellular free calcium and thereby increases cellular excitability. Here you can see that the local anesthesia, they will interact differently, however, with the neuronal phospholipid with or without the presence of the cholesterol. Thus, the interactions of the local anesthetic with the cellular membrane actually may help to explain some of the observed differences in the toxicity of the individual local anesthetic agent. These are some of the mechanism of actions and some of the interactions of the local anesthesia with different channels.